15. Yep. Okay.
Hi viewers, greetings from Penang International Dental College. Welcome to PIDC webinar series. I am Dr. Fawaz and my co-host is Dr. Lari. And today's topic is continuing with the COVID-19, and the word of this year would be the new normal. And today's topic is related to private practice and the new normal. And I am delighted to have with us three of our PIDC alumni to share their perspectives on the topic. I now request Dr. Lari to please introduce the speakers. Over to you, Dr. Lari.
Thank you so much, Dr. Fawaz. Good morning to all of you. Joining us today are Dr. Chan Ki-ying, Dr. Chong Meng, and Dr. Tani Han. So let me first start off. Our first speaker for today would be Dr. Chan Ki-ying. Let me just give you a small introduction. Dr. Ki-ying is a Batch 3 PIDC alumni and currently is a visiting consultant and director of Smile Dental Care Center, Gleneagles Hospital, Kota Kinabalu, and also practicing at Smile Orthodontics Specialist Clinic. She finished her BDS in 2012 and has been a multiple-time academic award winner. She is a constant figure in several NGOs and is very active in community service. We are very proud that Dr. Ki-ying has just been nominated as a candidate for Sabah elections, and we wish her all the best. So let's welcome Dr. Chan Ki-ying with her first topic.
Okay, thank you. Thank you, Dr. Lahari. Thank you, Dr. Fawaz. Thank you for giving me this opportunity to just share a bit of how I manage my practice during this crisis, this pandemic COVID-19. So we all always see this hashtag new norm, hashtag fight COVID, hashtag safe dentistry. So this is very important because dentistry is recognized as one of the most high risk profession in relation to COVID-19. So in the unlikely event, if you need to provide dental care during the pandemic, during the outbreak, so you have to make sure you take necessary steps to protect everyone, protect you, your patient, your staff, and the public. So if you're not taking any adequate precautions, then you might create like a cluster because of your practice. So this is circle of cross contamination. It means at any point, if we are being careless, and we might cause the infection to spread, and it might be very hard to control. So from dentist to assistant can go back to dentist, or patient to technician to another patient, so on and so forth. Okay, so we have to start this even before patient walk into your clinic. So what I'm doing in my practice is I refer to the latest guideline provided by the Ministry of Health regarding dental practice during this recovery MCO, and this was issued in August 2020, and I have picked out some relevant points for private dental practitioner. Before patient come to you, you have to make sure you do your screening, your triage, like you ask for their traveling history, their any sign and symptoms, any health sign and symptom, any close contact with high-risk patient, potential high-risk patient, etc. Okay, only make appointments via online phone calls. Never allow walk-in. Okay, so nowadays, all practice, I'm sure when the first thing that you when you welcome your patient are all these instructions to patient, like, okay, what you should do, what you shouldn't do. And then, so this is the main door of my clinic. We have a thermometer, okay? So you are advised to use no contact thermometer, so you don't come in close contact with your patient. Anyone who is measured 38 and above degrees Celsius, it is wise for you to not just like reject or not allow them to enter the premise, but also you have to make sure any new appointments to be made, it should be at least more than 14 days on for the safe side. Yeah, so you have to advise patients, seek medication, and etc. Okay, so only one patient will be allowed to enter. If adult patient that doesn't need companion, they have only patient will be allowed, and patients who is like disabled or limited physical ability, young child patient, only one caretaker or companion will be allowed to enter the clinic. Okay, so this is a video, just standard. Okay, when patient come, we open the door for patient to minimize them touching the door handle. Okay, you check the temperature, and then have to make sure everyone that enter your clinic wearing a mask. Hand gel is crucial. So gel the hand, make sure they rub it like 20 seconds or so, and then sit the patient. So this is our reception counter. We put like a bit of box in front, so patient don't go and lean against the counter and touch the counters. And then all those instructions, like remind patient to maintain social distancing. Once they're seated, don't move around, don't like touch things, just sit until they are called. And toilet at the moment is still not open to patient in my clinic, because you know we are very busy keeping eye on everything, make sure we maintain proper cross infection. If patient go to, like in any urgency case, okay, patient really have to go to the toilet, yes, you can allow them, but make sure no more toilet usage by any other patient until the toilet is like fully disinfect with sodium hypochlorite. So patients stand at a distance. Okay, so this was our waiting area before COVID-19. We have very comfortable sofa set. We have like brochures, magazine display for patient to read. But now this is our clinic. All our sofas were moved to the back, covered. It looks horrible, but we cannot do any other thing, because this is what we are supposed to do to keep everyone safe. So we put the chair further away, and we only allowed 4 people at the same point of time in the clinic. So if, let's say, what this patient is instructed to sit on this chair, so he will or she will be sitting on this chair before being called to the surgery, and then the chair will be reserved for that same patient. And then when he or she is done with the treatment out of surgery, he or she will be seated on that same chair until the patient walked out of the clinic. We wipe, we disinfect the chair, and the next patient can enter. So no more than 4 patients can enter. And we don't use like sofas or any chairs that you cannot sterilize, because it's very hard to sterilize if you have like a comfy cushion sofa. So we have installed this HEPA filter in our waiting area and in both our surgeries as well. There's no like very updated research saying that this will like 100% clear off the whatever viruses in the air, but this HEPA filter is definitely proven can clean off the air. Okay, so this is one of my surgery room with me seeing patient. So as you can see, we have a HEPA filter as well in the clinic, and the surface, the tabletop, we try to minimize item display, because when you have a lot of clutter on the tabletop, you are very hard to maintain proper cross-infection, because aerosols might rest on it, and you cannot just put everything into the autoclave and sterilize after every patient. So what we do is, this is another surgery, so we keep everything as minimal as possible. Okay, no clutter. So we are very fortunate. Our clinic, our surgery, we have windows. So we normally open a window in between patients to air the room, especially after aerosol generating procedures. Okay. And I use cling film a lot. Whatever surfaces that we might need to touch, or, you know, and with like keyboards, it's so difficult to clean all the small areas. So I cling film everything. If that you can replace the cling film quite easily. So my CPU, I wrapped it as well, just to wrap, basically cover everything that I can think of. More cling film. Okay, so this is the my dental chair unit. So I cling film the whole thing, because as you see the gaps in between the two compartments and the buttons, sometimes it's just very hard to go in and clean the area. So cling film, after each patient, you just wrap everything and then throw it away, and then new cling film up again. Okay, so disinfection of inanimate surfaces. After every patient, all exposed inanimate surfaces, we have to spray, leave it for at least 1 minute, according to instruction on your manufacturer instruction. So we leave it for 1 minute and then we wipe it clean. Normally when we do patient, like most of us, we practice four-handed dentistry. So dentists with one assistant that will assist at the side for suction or for other things. But now I think it's even better if you can add another assistant as a runner. So this assistant, her or his hand should maintain free of contamination. So just in case you need like anything in between procedure, he or she can give you a hand to get it for you, instead of for your assisting assistant to go and touch here and there. Okay, so every patient that come and sit in the chair, we encourage them to hold their belongings to them, instead of placing it all over the place, like put it on the chair, another stool or anything. Just ask the patient to hold their belongings to them and then sit them on the chair. Hand gel before and after is very important, especially every time when they touch their mask, because face mask is can be very contaminated. So you have to keep telling them not to touch the mask. After they touch the mask, give them hand sanitizer. Okay, so this is the list of PPE available in my practice. We will normally, depends on type of procedure, we will decide like what PPE to use. So we have coverall, like heavy duty, big coverall that only expose your basically your face. The rest is covered. And non-woven isolation gown that we used to wear before this, okay, the basic one. And then head covers, shoe covers, face shields, 3M goggles, 3-ply surgical mask, KN95 mask, N95 mask, 3M 6000 series respirator with 2 kind of filters, and disposable PE apron, sleeves, and also surgical shoes. So this is the way we put our, we use our PPE in my practice. So the one at the most left is more of not a PPE set up for non-aerosol generating procedure, like brace adjustment, or just a normal checkup, normal extraction, fluoride application, etc. And so when we need to do aerosolized procedure, we will go to the next, like N95 mask or even respirator. So for all patients, we will replace the plastic apron and also sleeve, because if you don't replace, whatever contamination that fall onto your sleeve, your gown from the last patient, it can actually easily travel to the next patient. But because PPE price is like shooting up really quickly, so we cannot, actually it's very hard for us to maintain, like for all patients, we change the whole set new. So this is what I'm doing in my clinic. We just replace the plastic sleeve and plastic apron for all patients. And so donning and doffing of PPE is very important. The sequence is very important to minimize contamination to yourself. Like if you don't do it in a proper sequence, especially removing your PPE, you can just transfer whatever contamination on the outer surface of PPE onto your own clothes, or so it's very important if you practice the proper sequence of, especially putting up, like taking off your PPE. And every time you done your doffing, wash your hands, don't skip it. Okay, so for every patient, before we start procedure, we let patient, this is the we practice iodine mouth rinse, because hydrogen peroxide, the taste can be quite pungent, like patient might not like it. So for my clinic, I practice betadine. So betadine is, I think, 1% or 1.5%. So I normally ask patients to rinse actually one minute instead of 30 seconds. Just make good use of the mouth rinse. Okay. Next is rubber dam. So I'm sure we dentists nowadays, we do a lot of procedure with rubber dam, because we are now so well trained with rubber dam, and we definitely understand the benefit of rubber dam and even the quality of the work that you can achieve with rubber dam isolation. So whenever you can, just apply rubber dam. Rubber dam is very good to reduce whatever droplets or aerosols. So you can do rubber dam when you do filling, root canal treatment definitely, and any other treatment that you think you can use rubber dam. Okay, so what I do is, because when you do fillings, we normally just use high speed to cut the hole, like do the cavities preparation, caries excavation. So what I started doing is I try to use low speed handpiece, or even like medium speed, as much as I can for caries excavation with manual coolant irrigation. I think this way it actually reduces water splashes more effectively, because I can see it from my facial. I still think this is one of the way, and also you don't overcut your teeth. So I like doing caries excavation with slow speed, although it take a bit longer, like take up more time. But I think that it's something that you can look into. So saliva ejectors is very important because you have to catch as much as water droplet or spillage or aerosols as much as possible. So you will have to have your assistant always hold a high volume suction and a mini saliva ejector. So why I emphasize four-handed dentistry, because sometimes we just think we don't need like scaling. Okay, I don't need an assistant. I just ask my patient to hold just to keep the saliva ejector in place, and then my assistant can go and do something else to save, like I don't need so much manpower. But I think for now we definitely need four-handed dentistry. If possible, in my clinic, I even do six-handed. So I have a runner standby at the side just to, in case, when I need something. Before I start procedure, I have a check, and then I will know what I want to do. I will tell my staff to ready everything before we start the treatment. So this will reduce the chances of cross-contamination better. So for lab cases, every lab cases, be it denture, crown, impressions, everything that will go in and out the lab, I think we should definitely disinfect. So you don't transport the infection from your clinic to the technician, and then from the technician to somebody else. And also every time when they send the case back, you have to make sure you disinfect as well, because you don't know whether they disinfect, or you just don't want any chance to give this COVID to spread. So, sorry, I just go back. So like these cases sent back from the lab, for the wax bite block, I soak it in cold sterilization, and then the cast, I spray it with disinfectant as well. You don't just disinfect the wax, but you leave this not disinfected. Okay, so for imaging, the guideline actually suggests if you can, you try to avoid intraoral periapical. So you take like extraoral imaging or PG or CBCT. But in case you really needed intraoral periapplication, you have to take extra precaution. So you can double sleeves in case the one on the outside tear, and then you still have one protecting, because the sensor, you are not going to put it in the autoclave to disinfect. So it's mainly you can wipe, but it's better for you to put a plastic sleeve, double plastic sleeve, and then one patient will be handling, like positioning the patient, put sensor and film into the mouth of patient. So this person will be only managing the patient. So any other thing else, you have someone else to do it. Like when you need to key in data in the computer, you need to click this or that button. Okay, so that will be a better way. Otherwise, when you touch the patient and then you need to touch the keyboard, then it will be difficult. Cling film again. So for me, like in my clinic, I wrap whatever I can, because no harm doing it. You just wrap it. If you have to, you have to touch it, and then you just replace it for the next patient before you do shoot X-ray for the next patient. And instruments. So for instruments, it's still the same. After you use, you have to disinfect, clean according to what you normally do. Nothing like, I don't have much changes in that, but in the guideline, they actually recommend single use for high patient that you think it might be high risk. But I think for us, private practitioner, the safest, if let's say patient is positive or really, really high risk, you should advise patient or refer patient to the hospital so he can get a better care and also better cross-infection control. So for my clinic, I have a staff that is stationed in the sterilization room throughout the day, so we don't go in and out the room that much. So we contain everything in there, and then heavy duty glove, facial, sleeve, gown, everything have to be on, even though there's no aerosols. But this place is the dirtiest place possible in the clinic. And in our clinic, we don't use, we use this like swing door, so you don't push the door with your hand or anything. Try to avoid any direct contact. Okay, so this is what I want to share. Okay, so how normally patient responds after this COVID thing when they come to clinic? Most of the patients, they're actually quite compliant with all this, SOP. You cannot do this, cannot do that. But they normally they are quite compliant because they know this is for the safety of everyone. But I won't be surprised, and you shouldn't be surprised. There will be patients that think that maybe they might make fun of us and think we are overreacting. It's like, oh, do we have to wear like that? That is like so too much. It's like you can go and do pest control to spread toxic. So, but you just need to explain to them, educate them, tell them why we have to do this. Okay, and then there will be patients that, despite all the effort that you have put, they will still worry and ask, are these clean? Will I get COVID from doing this? Do you clean everything properly? And they might even help you to clean your chair before they sit on it. There are patients like this. I mean, if they are cautious, I mean, it's good for them. So that one I will not mind. So the last one is medical history. So this is my personal encounter when I was doing, when you first caught your patient, you ask about medical history. Do you have any medical problem? And then they will be like, oh yeah, nothing else except COVID-19. Yeah, so you just have to laugh. So yes, thank you. That's all my sharing. Always remember, you are not only protecting yourself when you see patients. You have to make sure this is your responsibility to protect everyone. Okay, thank you.
Right. Thank you so much, Dr. King. That was an excellent presentation, and we've seen how meticulously you have, worked out all SOPs in your clinic. And we hope that our junior doctors and the other fellow dentists who are watching it take inspiration and are able to follow. Right, so we will take question and answers at the end of the session, so maybe we will move on to the next speaker. Thank you so much, Dr. King. Right. Our next speaker coming up is Dr. Chong Ming. He is a Batch 2 PIDC alumni and graduated from PIDC in first class in 2011. And since then, he has furthered his interest by successfully completed courses in implant dentistry. Currently, Dr. Chong is pursuing masters in prosthodontics from University of Hong Kong, and he's also practicing at Chong and Partners Dental Surgery. Welcome, Dr. Chong. The stage is yours, and I think your mic is on mute. Right.
Okay. Hi, good morning, everyone. My name is Dr. Chong. Thanks for joining me on a Sunday morning. I'll be giving an overview on infection control and dental practice. There may be some overlaps with Dr. Chang's talk, but a reminder is always all right. Okay. So as mentioned, I work in Chong and Partners Dental Surgery, but currently I'm pursuing my master's program. So these are just some examples, some pictures of my dental practice. Okay, before I start, I would like to say that I'm not a specialist in infectious diseases. I'm not, interested in any form of marketing purposes. I do not have any interest in any of these companies. I am just explaining whatever there is based on the available evidence and also current guidelines. Okay. So before we start, we have to revisit one of the greatest pandemics, in 1918, the Spanish flu. And if we notice that everyone in these pictures in the Spanish flu, they wore masks, they had some amount of isolation when they're in the hospitals, okay? And the reason why it was named the Spanish flu is just because it was widely reported in Spain. Spain had press freedom at that point in time in World War One, whereas other countries they actually halted some amount of the press freedoms, so that it would boost morale. Um, Back then, also they did mention already you have to wear a mask, you have to actually take care of your hygiene, all right, hand washing, okay, and they also have a set of rules like they publish in newspapers to actually try to notify the masses. And you fast forward to the COVID-19 pandemic now, you will see that there are certain similarities at which this pandemic is managed. Right, so you need to know some history. Face shields, masks, the hospital setups at which it is done. Right, they look fairly similar, along with along with public announcements that you should take into account cough hygienes, all right, cough precautions, avoiding touching your hands and face, sanitation, stuff like that. Okay? So there's actually a lot of similarities. Do not think that there is no similarity. The only difference is the pathogen that caused these problems. Now, the reason why surgical masks are worn is because it's designed to trap respiratory secretions. So based on this rationale, you actually have a public wearing face masks to try and reduce the transmission from one person to another. All right. And respiratory secretions are also included with the bacteria and viruses. So just because you're wearing a mask, it doesn't mean that you're saying that you only filter out certain stuff. Okay. You're actually filtering both bacteria and viruses, preventing them from infecting other people. So according to the Occupational Safety and Health Administration by the United States Department of Labor, dentists fall under the category of a very high exposure risk, okay, because we actually deal with a lot of aerosol generating procedures. So this is the first thing that every single dentist will need to know. All right, we are under a very high exposure risk. Okay, so we have to actually act accordingly. Now, in dentistry, we have dissemination of microbes either by direct contact with contaminated droplets, indirect contact with contaminated surfaces, and close-range aerosol transmission. Okay, so these are the three ways that dissemination can occur. So if we look at the exposure risk, they have lower, medium, high, and very high exposure risks. And if we look at this particular table, when you actually enter a known or suspected COVID-19 patient room or care area, you're already at a very high exposure risk. But we have to ask ourselves, does our setting cater towards the treatment of patients who are suspected or a diagnosed COVID-19 patient or not? So if, let's say, we think in terms of those kind of cases where, like Dr. Chang said, we screen our patients with medical history and questionnaires, generally, more or less, we fall under medium unless you actually have some kind of aerosol generating procedures which you're actually working on. So according to the CDC, you have standard precautions, your hand hygiene, proper PPEs, disinfection of environment, instrument sterilization, and also the patient placement. All right, patient placement meaning how you actually schedule your patients, how do you physically distance the patients from one another. But these are standard precautions that you follow, irrespective of whether the patient actually have or do not have any form of infectious diseases. But you also will have to consider transmission-based precautions, whether they be contact, droplet, or airborne precautions. All right, so contact precautions, you have patients who are placed appropriately, meaning they do not come into close contact with one another, any form of coverings if they have to, face masks, all right? Appropriate PPEs, donning and doffing sequences, okay, those are very important. Limit the patient movement within the healthcare facility. disposable equipment for the patients or dedicated patient equipment, which means single-use instruments or equipment that you can sterilize. And then after that, cleaning and disinfection of rooms and surfaces. Droplets, same thing, more or less, all right? Airborne precautions. Face mask on the patient. You need an airborne infection isolation room, all right? Restriction of susceptible healthcare workers in the room, which means if they are, for example, immunocompromised, you do not want them anywhere near the patients, okay? Appropriate PPEs, fit tested N95 or higher, limited patient movement, and also immunization. So the CDC actually summarizes all this with very, very good pamphlets that you can actually download on their website, all right? So please go and check out the CDC's website if you can. Now, the difference between droplet and airborne precautions is by droplets, you have respiratory transmission through sneezes, coughs, and even to a certain extent speech. And the particle sizes are 10 microns or larger. Okay. However, the organisms actually do not remain infective over long distances and occasionally do not require very specialized air handling or ventilation. So, for example, positive pressure rooms or negative pressure rooms. Okay. Airborne precautions, on the other hand, they are transmitted by the airborne route, tuberculosis, measles, chickenpox, herpes zoster, and generally their particle sizes are less than 5 microns, according to the Organization for Safety, Asepsis, and Prevention. So you have different ways, because now there is a debate whether there is an aerosol transmission of COVID-19. So airborne transmission is basically either obligate, which they only go through aerosol transmissions, for example, tuberculosis. Preferential, meaning they go through multiple routes, but they are predominantly transmitted by aerosols for like measles and smallpox. Opportunistic, meaning, if they can do it, they'll do it. So infections can actually cause diseases through other routes, but can also initiate infection through the lungs. All right. So for example, SARS. Okay. So for any disease to happen, you need to have a few things that favors the disease happening, assuming the other factors are actually equal. So viral load is an important factor, the route of transmission, and the pathogenicity. So a viral load meaning it doesn't mean that one particle of virus enters your body, you get the disease. No, it doesn't mean that. Okay, it has to have the load to actually overcome your immunity. That's the first thing. The route of transmission. Okay, specific diseases, specific pathogens have their own routes of transmission. So that is another thing that you have to understand. For example, when AIDS was first discovered, right, the HIV viruses, I think in the 1990s, OSHA mentioned that because it's a bloodborne pathogen, all right, gloves were actually introduced to dentistry. If you see back then, very old times, dentistry was not practiced with gloves at all. Okay, pathogenicity, which means your virus will have to be very, very virulent to actually overcome your immunity. So if you have a combination of these three, you would get the disease. So unfortunately, we do not know what the viral load is for SARS to actually cause an infection. The airborne transmission of SARS is currently unknown. And as of June, there is no data available that SARS is transmitted during dental practice. Okay, but this may change as studies go along. Talking about PPEs, you generally have PPEs according to OSHA for well patients and patients who are suspected or confirmed with COVID-19. But if you do not have aerosol generating procedures, there's no real need to really put on a huge amount of PPEs. All right. But the moment you have generation of aerosols, you need to wear your gloves, gowns, eye protection, okay, NIOSH certified disposable N95 or better. All right. So you can actually see if you have no AGP, PPEs, no, not really. Consultation, no, not really. But the moment you have treatment, then you need it. So let's compare the mask and the respirator. There's a lot of people that are saying, this is better, that's better. Let's take a look at individual first. Okay. So one thing about face masks is that they do not require fit test. They do not require seal checks. Okay, and they're very loose fitting. So generally, they're actually worn to prevent the wearer from spreading something to another person. Whereas an N95 mask, all right, they're very tight fitting. they require a fit test and they require a seal check. And they actually protects the wearer from exposure to particles or other aerosols, but it has to be non-oil-based aerosols. So to those who don't know how to wear an N95 mask, all right, these are the sequences that you have to wear them. But you have to understand, after you wear it, you have to conduct two tests. One's a seal check and one's a fit test. If you have a supplier selling you a mask and they do not do a fit test for you, they don't know what they're talking about, because N95 masks, as far as I know, they only have three sizes: small, medium, large. Which size fits you, you don't know. So you need to do a fit test. Once you do a fit test, then do a seal check to make sure that you do not have any leakages between the mask and your skin. All right, so both tests will need to be done, but they're not equal to one another. Okay? So just a reminder again, because the next few slides will be talking about this. Droplet precaution, airborne precaution, the particle sizes. So if we look at the coronavirus, okay, it is 0.06 microns to 0.14 microns on an average, give or take. And the N95 mask filters 0.3 microns of particle size. So if we take a look at it that way, wouldn't the coronavirus particle just go through the N95 mask? No, because you have to understand, according to Lindsay Marr, she's an environmental engineer, but she specializes in infectious diseases, okay, aerosol sciences. Coronaviruses generally do not come out naked. All right, they're usually encased in droplets. And you know the droplet sizes are 0.5 microns or larger. So from that size alone, the N95 mask will actually filter it. But any other smaller particle sizes, okay, if let's say coronavirus is too small to be filtered without it being encased in droplets, the coronavirus is so small that it goes in a Brownian motion, all right, which means irregular motions, if you remember your physics, okay, when it gets knocked around by larger particles. And imagine a person who is like drunk and crashing into the furniture as he walks. So the N95 mask has electrostatic capabilities which attracts the virus onto its fibers. So that itself already is another way that the N95 mask can actually filter coronavirus from the patient or from the wearer. Okay, so it does not act like a sieve where you try to pour something, sieve it through, the larger particles get trapped, the water comes out. No, it doesn't work that way. So the burning question is, which mask should I wear? If we take a look at studies, okay, surgical and N95 masks were equally effective in preventing the spread of PCR detectable influenza. And another paper by Loeb, this is a very nice paper, okay, the protection afforded by a surgical mask against influenza is similar to the N95 respirator. So, however, they did put a caveat. If there's limited availability of N95 respirators, okay, the surgical masks appear to be non-inferior to N95 respirators for protecting healthcare workers. So, if you can't get a respirator, you can actually make do with a face mask, because again, it comes back to your universal precautions where you wear protection, all right? You wear your gloves, you wear your mask, you wear your face shields, you work a certain distance from the patient, you're screening your patients. So there's no doubt there's a need for you to be careful, but you're actually being careful for every single patient, irrespective of medical status. Unless the patient has an airborne disease which requires very specific setups, you won't be seeing that, because why? We generally work in general practice. Okay, so there are actually a lot of conflicting recommendations. WHO says that you wear masks in low risk situations, respirators in high risk. CDC says respirators in both low risk and high risk. You have to evaluate it for yourself. Okay, guidelines are just guidelines. Recommendations is recommendations. Law is law. So you have to think, evaluate case by case. So the use of N95 respirators compared with surgical masks is not associated with a lower risk. So again, there's a pattern emerging. So basically what they're saying is that you can wear surgical mask or you can use N95 respirators. If the cost is not prohibitive, if the supply is good, then you can wear both, all right, if you really want to. But N95 masks should not be recommended for general public and non-high-risk medical staff. Okay, so this is more in line with supply and demand. Now we have very little N95 masks going around, so the general public don't really need it because they're not exposed to very high-risk situations. For example, like respiratory care wards, high dependency wards, okay, so they're not there, right? So they don't need N95 mask. A surgical mask is sufficient to actually help out. Now, KN95 respirators, if let's say, we ask how is it different from N95, the CDC actually has done assessments. Okay, you can go to this website to actually take a look at the list of KN95 respirators. It is a very nice, very well documented website. It's last updated just 2 days ago. Okay, so please take a look at it. If you have any KN95 mask, find out who your supplier is and look at this website to see their maximum and minimum filtration efficiencies. So just give it a thought. All right. Surface disinfection. According to the EPA, okay, you have actually a lot of chemical solutions used to actually disinfect surfaces for various types of bacteria or various types of viruses. So companies will claim that they clean this, clean that, disinfect this, disinfect that. If you want to actually verify their claims, you can look at the EPA's website. Okay. So aerosol management, according to the CDC in June, if you need AGPs, all right, 4-handed dentistry is a minimum. You need to use a high evacuation suction and usage of rubber dams. All right, that is pretty much the same as most of what we're following now. So if we look at this video, if saliva was red, it is a very interesting video. Okay, it just shows you how viruses, or rather, these spatters actually affect the dentist, affect the nurses. But I know you must be saying this guy's not wearing any masks. This guy is not, having any personal protection. Yes, there's a longer video, there's a longer version, but I actually just shortened this to show you actually what can happen if you do not follow universal precautions. Okay, so like Dr. Chang, what I tend to do is I actually work with 6 hands. All right, because the moment that you touch the patient, you're contaminated. The third pair of hands will actually do the running. They'll get your materials for you if needed. But even the third person will have to wear gloves. Because remember, aerosols, generally, they can transmit up to maybe 1.3 meters in the dome shape from the dental chair. So you want to actually take into consideration not only just the chair alone, all right? Whatever there's a vicinity of 1.3 meters, if you want up to 2 meters around, disinfect everything. So this is how it actually looks like. Right, where and what is going to be red. So red is everything that's contaminated in your hands. I'll show you some studies later which actually supports these claims. So for every 1 milliliter of saliva, you actually have 100 million bacteria, 2,000 hepatitis C viruses, and what's all the rage now? SARS-CoV-2, right? SARS coronavirus 2, 158,000 particles in 1 milliliter of saliva. Okay, so that's the latest 2020 research. And if we see aerosol peaks during treatment, all right, if you look at the figure in the middle, this study is a very nice study whereby they actually determined the levels of bacteria during treatment in a surgical room. Okay, so the peaks actually start within 10 to 15 minutes and reaches its maximum ceiling around half an hour or so. But after half an hour, the peaks will actually go back down again to a very, very low level of aerosols within the dental setting. So in my practice, where there is limited chairs, all right, we only have 2 chairs, all right, and 2 dentists working. What we tend to do is that based on this study, all right, we will try to schedule the patient after half an hour from the previous appointment. So if a patient comes in at 1 to 1:30, the next patient's appointment is actually 2. Because why? It takes 30 minutes or so for the bacterial levels to actually drop within the surgical setting, all right, within the surgery room. If, let's say, you have a spare room, 1 unused chair, then yes, you can keep alternating between dental rooms without having to actually have a 30-minute wait time, okay? And this particular study also has actually shown that despite the fact that you have aerosol production, there was no dissemination into waiting areas, and there was actually no aerosolized blood which was detected. But you have to understand, these were done in general practices. We don't know how big is the general practice. If the general practice is tiny, is it big? Is it well ventilated? Are there positive and negative airflows? Again, that's another issue that we have to ask. So they actually found out that scaling actually produced the most amount of contributed the most actually to the peaks compared to drilling or even extraction. So there are a lot of papers which suggest that rather than using 100% by strength at was it 70 or 30 kilohertz? I can't remember. All right, they would suggest for you to actually use 70% instead. You don't have to go to the max volume. Okay, max volume would also, if in terms of patient comfort, can be quite uncomfortable. So the lower the strength, the aerosolization is actually a little bit less. So that's one thing. So if you do not wear any protective measures, a 15-minute treatment would actually lead to the inhalation of approximately 0.014 to 0.12 microliters of saliva. And if you do the math, that's about 2 particles or 20 particles of coronaviruses per treatment every 15 minutes. So do the math. If we don't know what the viral load is required for COVID to actually develop, you might want to actually consider doing PPE. All right, don't be a hero. Now, in light of these coronaviruses, floating around, a lot of companies start showing you extra oral suction devices. And actually, I do remember on my Facebook, a lot of dental suppliers, they start to promote these kind of things. They show you how they actually suction off all the aerosols, and they demonstrate it in front of you. But this is not new. All right. Previous studies, they have actually attempted to do this before, a very long time ago, but they were more experimental rather than dedicated machines. They actually retrofitted old vacuum cleaners, or they actually retrofitted extra stuff onto the suction, or even the hand pieces. All right. But we're talking about dedicated extra oral suction devices now. So 2020, it just got published, I think 2 days ago again. This is a graphic representation of where the contamination occurs the most, on the dentist and on the assistant. And if you see, majority of the contamination is at the chest and at the face shield. Okay, to a certain extent, small pinpoint dots at the back of the operator and at the assistant. Now, this is a very small portion of the paper. All right, you have to read the paper in order to actually understand why this is important. So please, again, read this paper, find this paper. It's free, it's available. And what it tells you, that even if, let's say, you utilize an extra oral suction device versus a non-extra oral device, you actually get the same frequency of contamination at the same sites, more or less. The only difference is intensity. The intensity is reduced from a range of 33% to 75%. But this is not an experiment. All right, this was not research. This was actually only a simulation. They did not repeat these findings. They did not have any positive controls. They did this in a hospital setting where the airflow between a closed surgery and open surgery is actually different. So there are actually many variables to consider. So stay tuned to actually look for this paper, look for newer updates, because they actually mentioned that forehand dentistry and appropriate usage of rubber dam is still the primary mitigating factors for aerosol management, and extra oral suction devices can only be tentatively recommended for the reduction of spatter. So yes, if you have the resources to get one device, yes, you can get it, but right now, the primary means, or rather the efficient means, is forehand dentistry and rubber dam. And to a certain extent, if you want pre-procedural mouth rinse, but that only reduces the viral load in the mouth. How about those patients where they breathe out from the lungs, right? So that's another question that we have to answer. So OSAP has actually summarized the levels at which you can mitigate all these transmission risks: the elimination phase, the substitution phase, engineering controls, administrative controls, and PPE utilization. The best way, the most effective, is to remove the hazard. You screen the patients, all right? You isolate patients who are symptomatic. Of course, we would like to do viral testing on the spot, but it's not currently available, okay? And whatever that can actually lead to cross-contamination is removed. So your magazines, whatever pamphlets that are not very important for the patient, non-essential items on the dental surgery, these kind of things, you should remove them. Hazard replacement, again, You postpone the treatment plans if the patient does not need it just yet, limitation of close contact. So these are all available on the website. Okay, I'm not going to elaborate much on this. Most importantly, you have to understand is nothing is 100% safe. Our job is inherently risky. All right, as per OSHA recommended, as per OSHA's findings, we are at a very high risk of exposure. So if you want to be safe, stay home, don't do anything. That's the best thing I can tell you. All right, we can only mitigate risk. We cannot evaluate. We cannot completely eliminate the risk. Okay, and facts over fear. You have to read the facts. There are a lot of people spreading news about this will happen, that will happen, or a lot of unfounded accusations or very unfounded statements. Please refer to authorities, all right, and not just any authority like the Ministry of Health, CDC, WHO. Refer to them, all right. Most importantly, there is no one particular solution which fits every single patient. So you have to evaluate the risk as well. All right. Thank you, and that's all.
Yes, thank you so much, Dr. Chong, for the excellent presentation. You have shared with us some very important information regarding the current practices and evidence-based approach. We would also like you to share some of these links on the Facebook comments so that some of our viewers,
Sure.
go to those links directly. All right. So we will get back to you at the end of the session with the Q&A. And meanwhile, we move on to the next speaker. Yes. Let us welcome now Dr. Tan Ihan, who is
Hello.
also a Batch 2 PIDC alumni. He graduated in the year 2011. His special interests include implant dentistry, dental microscope usage, laser dentistry, and digital dentistry. He has recently created a Facebook page called Gigi Han and shares videos on social media about dental topics of concern to patients and is already having over 6,000 followers. Wow. So his special request to us, to the viewers, is to have a pen and paper or another device along so we can have a brainstorming session together. So please welcome Dr. Han.
Thank you, Dr. Lahari. Thank you, Dr. Fawaz. And thank you, Mr. Hasli, for organizing this wonderful webinar for all of us. So good morning. Still good morning, right? Okay, so good morning, everybody. I'm Dr. Han. So what I'm going to talk about is the second and third part of this webinar, which is staying creative and connected. And also I'll be talking about new business strategy. When we were in, there will be three parts of my presentation. The first part will be, I will be talking about Blue Ocean strategy. Second part is what is my approach towards the Blue Ocean strategy. And the third part is that I will introduce you to some other online creators that in the country and also in the region. So for this purpose, I would like you to prepare paper and also a pen. And also, if you have a second device for you, for example, if you are watching this on your smartphone and you have your PC beside you or your laptop beside you, please turn on your laptop and log into Facebook or log into Instagram, because when I'm introducing you the interesting person online, that you can add them straight away. So let's get into the presentation. First part is that I will be talking about Blue Ocean strategy. Before we know about Blue Ocean, we need to know what is the Red Ocean and what is a Blue Ocean. During our time in government sector, from 2009 to 2017, everybody was mentioning about NBOS. I was not personally directly involved in this, but you look at all these 6 points. Are they really working? They look very grand. They look very good, but when it trickles down into the clinic level, they tend to be like, I want to reduce the waiting time. I want to eliminate the waiting list from the clinic and so on. It tends to become like a Red Ocean strategy rather than Blue Ocean strategy. So what I want to do today is to bring you back to the basis, bring you back to the foundation of Blue Ocean strategy, and we work out what can we do as a private practitioner. If you are students, yes, it's good for you also for you to think about your future, and let's go into it. What are red oceans? We want to know what are red oceans before we can venture into the blue ocean. Just imagine there are a lot of sharks, right? Every big sharks in the sector, they come into the ocean and try to catch whatever fish they are able to find. They fight among each other, against each other, and they make the whole ocean red. So basically, this is the condition, or this the situation that we are in right now. You see, they compete in existing stage and they try to beat the competition. Whenever I gain something, I get a percentage of market share, you lose a percentage of market share. So this is our challenges in the industry right now. We have increasing number of dental graduates. We have for the past 4 or 5 years. Thank you, Chun Hao, for providing me the data. Past 4 or 5 years, we have every year we do have around 1,000 graduates, or a little bit more than 1,000 graduates each year. This causes the saturation of dental clinic, and the side effect will be the domination of dental chain, where they have a lot of resources and might pose a challenge to the smaller practices. And of course, Malaysian public generally have under par dental awareness compared to our neighboring country, for example, Thailand or even Singapore. And also, we have lack of dental insurance coverage. And the last one will be there is attack of illegal practitioners. I'm sure you heard of beauticians that they do veneers and they do whitening treatments for the customers, and the authorities is kind of crippled in this sense because of our law. So what are blue oceans? Now we know we are in a competitive world, competitive sector, and we want to know what are the blue oceans that we venture into. There is no competition, that we can have our own share. So the foundation of this we have to look in is value innovation. What are the costs that we can reduce? Cost doesn't mean, it is the cost to the business, cost to the patients, cost to the industry that you can lower, not just your regular day-to-day cost, but the cost that is unnecessary. Yeah, and you increase the value from the buyer by providing them what they need, or even what they don't know they need. And when you have these two combined, you have value innovation, and you achieve your blue ocean status. So these are the comparison. When you have blue ocean, you create an uncontested marketplace, and you make the competition irrelevant. You create new and you capture new demand. You break the value and cost trade-off, and you align the whole system for a firm's activity and in pursuit of differentiation and low cost. You can have a lot of differentiation at a very low cost if you imply this blue ocean strategy. Okay, so this is the time where I want you to take out your pen, your pencil, and we do a little bit of brainstorming session with me. So this is what I want to mention it to you, the framework of blue ocean. Yeah, the framework of blue ocean consists of the strategy canvas and also 4 action framework. I will go in one by one. So let's start with an example when we want to draw the strategy canvas. Yeah, we start with an example. The first example is actually an Australian wine company, Casilla Wines. Before Casilla Wine and the Yellowtail Wine, the wine industry consists of bottles that have a lot of complex terminology. Yeah, very difficult to choose a wine, and they mentioned about the vineyard prestige and legacy. A lot of wine range. It's very difficult for the customer to choose a wine that is suitable for them. They find it very difficult, and it is not fun, and they tend to just go away to some other beverages like beer. They just grab a beer because all the beer look the same. They just grab one and they have fun. So what happened to Casilla is they thought of this problem, and what happened is they created this Yellowtail, where they have the same bottle for the red wine and also the white wine, which was unheard of in the industry prior to this. And they have a very exciting kangaroo in front of them, stating them they are fun, they are from Australia, they are exciting, and you know what? they are now the #1 imported wine in Australia. So let's, on your paper, please follow me. You write down these 3 words: the strategy canvas. The strategy canvas, you write it down. Okay, there is a horizontal line. Don't write anything, just draw 2 lines over there. One line, horizontal axis, and the other one is the vertical axis. So what are the things that you need to write down over there? We'll talk about it later, but first let's show this example. When you have the brown color line for the premium wines and you have the budget wine at the yellow with the yellow line, and you see they have a very similar pattern, right? Just that one is higher, one is lower. The emphasis of the price, one is high price, one is low price. One is the wine terminology, broad marketing, and so on. So this guy, Casilla Wines and Yellowtail, they came in and they disrupted by lowering the unwanted cost, unneeded cost, and they even invented and created whatever that is fun, ease of selection, and drinkability, which was unheard of for the other competitors. Okay, so I want you to have this graph line chart right now without the lines. Yeah, we'll look at dentistry later on. So on the second part of the A4 paper, I want you to write down these 3 words also: 4 action framework. Please write down 4 action framework and draw this rectangular box. Okay, on the left side, you have eliminate and reduce. On the right side, you have raise and create. Yeah, if you miss this, never mind. Okay, I'll continue with this example. Yeah, in this example, so what did the Yellowtail did right? They eliminated the complex and difficult wine terminology. They eliminated complex marketing and aging quality. They reduced the complexity, the wine range, and the prestige and legacy of their wines. And they raised their price. On the right side, they raised their price versus the budget wines. And also they created an easy drinkability, ease of selection, fun and adventurous wine. Yes, this is what they have eliminated, what they have reduced, and what they have raised, and what they have created. Let's look back to dentistry. Yeah, once after this example, we can know that the strategy canvas of dentistry, this is what I want you to draw. Yeah, write down #1, price. This is the value factor. The horizontal axis will be the value factor. Yeah, price, qualification. It's just like you go into, when you're searching for a new clinic, you're searching for a new doctor. What are the factors that you pay attention to? The first one is price, qualification, reviews. You want it to have good reviews. Yeah, when you go for a dental clinic, private dental clinic, you want to see good reviews from the clinic. You want friendliness of staff. You want cleanliness of the clinic. You want the clinic to be close to you, easy to park your car. You want the clinic to have low waiting time. Pay attention to the slope there. You want to go there according to your appointment timing, and you want the doctor to see you right away. And you want to have the perception of pain to be low when you go to the private dentist. Yeah. Okay, let's look at the government sector. Government sector, they are kind of opposite, but they do have a similar pattern. Yeah, they have low price. You cannot choose your doctors. Whether the clinic has good review, bad review, you still have to go because that's the only one in the area. The friendliness of staff, you and I know how government clinic works. And when you have overcrowded and overworked kind of situation, very difficult to maintain cleanliness. And the accessibility, the only clinic in the area, sometimes very difficult for you to go. And you go there in the morning, you can wait until noontime or even worse, before the doctor sees you. And also because of they are rushing, then they might cause pain to you. Hopefully not. If there is any government doctors working there, my apologies, because I was also in government. I know the excessive workload, and there are some things we just cannot have control. Yeah. So once we get, okay, I hope you have already drawn out this graph. Yeah. If you don't, please let me know. I will pause. And then the level on the vertical axis will be the level of importance, how much of emphasis or you, the industry, the customer pay attention to and put emphasis on. Okay, so once we have the strategy canvas, we have the 4 action strategy. you have to step back. Let's step back and think, where do you stand? Where do you want to stand out? I'm a GP, you are a GP. Unless you're a specialist, of course, you are in a different blue ocean. If I'm a GP and you are a GP, then you have to think, where do you stand and where do you want to stand out? So what you can do is you look at this canvas, a strategy canvas of dentistry, and you think, what else you can increase? What else you can raise? What are the factors that you can create, right? And be different and stand out from other red ocean clinics, and you create your own blue ocean. So why I leave this blank here? Because this is your 4-action framework of your own practice. I want you to have this 4-action framework box. And after this seminar, please give yourself some time and think, what do you want to eliminate? What do you want to reduce? What do you want to raise? And what do you want to create? And hopefully we will be in the blue ocean together. So you may not have a lot of ideas that what do you want to do? Yeah. So the first one, you can look at your customers' alternative. I'll give you some examples to kickstart your thought processes. You can look at your customers' alternative, like for example, AirAsia. When they wanted to compete, they are not competing with mass airlines. They are competing with bus companies. They want to, of course, nowadays people have different opinions about them. But when they first started, they price their tickets so low that, when you think you want to travel, you think whether I want to take an AirAsia plane or I can take a bus. That is how cheap their ticket was. So that's how they created their blue ocean and stood out from the rest. Look at a different strategic group of your industry. Okay, an example is Curve Gym. Ladies, some of you ladies, you want to exercise, but the thing is you go to a commercial gym and you have this perception of all the guys are looking at you, you're not comfortable. So what Curve Gym did was they set up a gym in housing area, suburb area, and they only have ladies members, and their setting is very small, and everybody work out together in a small circle. They have good rapport among each other, and you know what happened next? They became the largest gym in US, and they are now spread all around the world. Even in Malaysia, they have around 10 branches nowadays, just because they have tackled this blue ocean. Consider different buyers in the chain. What do I mean by that? So, for example, this NovoPen, traditionally drugs companies go to doctors and ask the doctors to prescribe their medicine, prescribe their drugs to their patient, But what NovoPen did was they found the pain point in the industry where the patient has to inject a needle into the vial, take their insulins and use the needle to inject in themselves. They come up with a new design because they know this is a pain point to the patient. Because when you look at it, it is injecting something into yourself. You look at your drug addict, it is a not good image. So they designed this thing, and what they did was they marketed to the customers. And who is the biggest insulin company now? Obviously, NovoPen. Yeah. Next, something related to us. Aligners companies, they are also searching for a different kind of customers. They manage to bypass dentists and they market it directly to the customers, the patients. They don't even call them patients. They can straighten their teeth. Okay, side note, although they are kind of carving out their own blue oceans, but I have to remind you that if you work with all these companies, it's fine. But if there is any issues that come out, you will not be covered by MDA, MDC. Yeah? They have made an announcement about this, so try to step away from all these smaller aligner companies, unless you are the one that is able to sit down and plan the treatment for the patient, and you take the full responsibility for them. Okay, blue oceans. Next one, what are the ways? You can look at your product and your services complements. What are the pain points before they use your product or your services? What are the pain points during? What are the pain points after? You try to solve them, and you can create your own blue ocean. Let's look at Dyson vacuum. Before Dyson vacuum, there is absolutely no vacuum cleaners that have no bags. Every time you vacuum, you have to remove remove the bag, clean the bag, tap it, and you create dust everywhere. So they created this, and they are now they created this vacuum cleaner without a bag, and now they are the #1 premium brand in the vacuums. And also another example, IKEA or IKEA, whatever, however you pronounce it, they usually have a setting location where they are away from the city center, where it's a bit difficult to go to. So they sell, besides furniture, they mostly get their revenue from their furniture, but at the same time, they sell very cheap food. They sell, they even have this kids corner where parents can leave their kids there, they can go and do shopping. For them, it is a family outing. You can spend a whole day there and look at the queue. Everybody wants to go IKEA. Everybody knows IKEA. Yeah, and also you can add function or emotion to your products. Yeah, make it functional. Swatch, they are cheap watch, but they make it so trendy that become a fashion icon. Starbucks is just coffee. It costs nothing, but they manage to sell 15 ringgit per cup, because for them, they have transformed a function into emotion. So what can you do to transform function into emotion? And what emotion can you do to reduce into function? This is something related to us also. I like to compare dentistry to hairstyling, because we work with our hands. So this QB house in Japan, it is a ritual for you to go to a barber shop. You get a haircut, massage, hair wash, everything. It costs a lot of money, and it costs a long time. So what they did was they just, customer come in, they have 10 to 15 minutes cut. They don't even have hair wash. They will just vacuum off your hair. They were set up in all these metro stations, and they became boom. Now they even have branches all over to Singapore also. And you look across time. Look across time means you need to know what is the trend. iTunes knew the pirated downloads cannot be going on forever. They need something to complement their iPods. So they have iTunes with 99-cent downloads, and they became the #1 company. But at the 2010 era, Spotify thinks that we no longer want to download our music, and we don't want to be limited to our own music. We want to have a vast choices of music at our fingertips. And they launched this music streaming company, and now they have become the #1. You see, companies keep producing, creating blue oceans, and it is always changing. So I will be telling my story of how I think I am creating my blue ocean. So during MCA time, first week after MCA, I was really bored. My clinic kept open, kept operated, but I didn't know what to do. Yeah. One day, sometimes I don't see any patients. Sometimes I see one patient. I got bored, and I started to put my phone in front of me, and started to take videos of teaching people how to wear a mask. So after that, very surprisingly, it got a lot of shares, and it got about 20,000 views. So I started, hey, this thing, maybe I can start to venture and spend my a little effort to make it. So I created this page, the Gigi Han page. If you have your device with me, you can log into Facebook or Instagram, and you search for Gigi Han, and this is my page. I would like you to follow me as well. Yeah. Okay. So one video after each one, slowly, and then the real breakthrough came when I was mentioning about mask standard, just like how Chong Ming has mentioned in his previous talk, that I also made a short video. At first, this is a 10-minute version. 10-minute version got quite good, but some of my colleagues asked me to shorten it, and I shorten it. I make a new video, shorten it to about 5 minutes, and boom, it was uploaded to 2 places. My page and my company's page, and also it was pirated to a blogger's page. And then total on, I guess we get 800,000 to 1 million views in total. Yeah, so quite a big boost for my page from there. So I would like to show you how I make, what is my setup. I have on the top two, left and right, is the teleprompter where I can have the script getting shown and the camera or the phone is situated behind there. Yeah, mic is also very important. Look at the bottom right, mic is very important. This is what I'm wearing right now, a wireless mic. You can also use a wired lavalier mic because if you make a video with a bad audio, everything will be quite trash, yeah, because people can't hear what you are saying and so on. It won't be a good video. So your audio for your video is very important. And also I have a light over there. So this is the whole setup in place. I'm not doing this alone, but of course, most of the time I'll be shooting alone. But also I have Dr. Koo Lee Kian. Dr. Lee Kian, he's an oral surgeon that worked on 1 or 2 videos with me. We have also planned to do a video regarding implants in the future. And also that Dr. Stephanie Ho, she is an orthodontist from NUS. We shot, she did quite a number of ortho videos for my page. And also Dr. Shane Heng, person in charge in Sri Petaning. She's like my Mandarin video maker. So all the Mandarin side, Chinese side, she will be taking care of that. And also I have made a few videos with Dr. Ong Pejia. So look at my team, look at my partners. I'm sure you know that I won't be quitting making videos very soon. Yeah, I have very good partners. So let's proceed. Okay, we have little time left. Dr. Benji. Dr. Benji is Insta famous. You can look for him at the handle at Dr. Benji. He is the person in charge in Q&M Makota Cheras, but his posts are mostly skincare based. And recently he has more and more dental related video, but public centric dental related videos. Dr. Kayla Te. Okay, Dr. Kayla, she's a proper, in my opinion, she's a proper video creator. Yeah, she has 33,000 followers on Insta and 15,000 followers on Facebook. And to me, you know, she's a proper creator and she has not a very big following. So, you know, in my opinion, this is a blue ocean that I can tackle into, that you can also tackle into. Just imagine how much time you spent yesterday or day before or today watching your smartphone, right? Watching YouTube, Facebook, or even now you are watching live on Facebook. So this is really a market that we can really tap into. And also Dr. Hafiz Zainal, he is kind of like a celebrity now. He sings a lot. He participates in a lot of singing contests. His IG, you can follow him at Dr. Hafiz Zainal. And also Dr. Rizal. Yes, this is an interesting one. Dr. Rizal, please follow him on Instagram, Dr. Rizal Rizki Akbar. Very big following. He's an Indonesian doctor. Very big following, 252,000 on Insta. He keeps sharing clinical photographs, beautiful photographs. Yeah. And the next guy is also quite similar, Dr. Gria. Dr. Gria from Indonesia, also he has a very big following on Insta. He also share a lot of beautiful aesthetic cases online. Yeah, please follow him, Dr. Gria. He also make videos about clinical procedures also. Very interesting. Yeah. Dr. Ibrahim Shah from Eye Care Damansara, also an influencer with 20,000. Dr. Afifa, she is in government sector. Her posts are more towards family, lifestyle kind of posts on IG. And Dr. Muhammad Ashraf, Bobby. So Bobby, he tends to, in my opinion, I don't know him personally, but in my opinion, he is trying to follow the footpath of the doctor on the left, Dr. Gria, and also the doctor on the right, Dr. Rizal. I guess look out for this guy, Bobby Dental Works. He is up and coming. He is following the footsteps of Dr. Gria, Dr. Rizal, and he will be big soon. He's from Avicenna Dental Care in Putrajaya. So honorable mention. Yes, Dr. Javel. Dr. Javel, a lot of us would know him. He used to teach in PIDC. He's an endodontist. And during the MCO, around the same time, we started our channels. So his channel on YouTube is Easy Endo with J. He shares videos that are very easy to understand, not long, short and sweet. So each videos you watch, you will get some tips for your clinical practice. Very, very good. Please follow. Please go to Easy Endo with J and follow his channel. Okay, let's move on to the next slide. Okay, I'll be ending my slide soon. Yeah. So, what are the perks of creating online videos? If you have more than 10,000 followers on Facebook or more than 1,000 YouTube subscribers, you will be starting to get monetization from Facebook or YouTube. The good thing is because they are different companies, so you can shoot one video and upload it to 2 sites and hopefully get monetized from 2 platforms. Isn't it good to get money from Sundar Pichai? Isn't it good to get money from Mark Zuckerberg? I'm looking forward to that day. So also you can do product placement. You can have sponsors and talk about their products and they sponsor you something. Yeah, that's another way of making money. And also you get to have exposure at a very low cost. You get to speak to your customers, let them know what is your interest, what are your latest updates, and you might be able to speak to non-customer because you will never know what happens on the internet. It spreads like wildfire. Everybody, even international people might know you accidentally. Yeah, so that's how you get to expand your circle. So for me, I get to meet this viral doctor, Dr. Kenneth Wong. He was a frontliner in Maib's Sedang, the quarantine center. He got a post that got millions, hundreds of thousands of shares. And then I very luckily, I managed to get him an interview and put him on my channel. And also I met this boss from Empro. Empro, you might know them from the eyebrow company in Mid Valley and so on. So I met the boss, he approached me and we have collaborated and we made some videos regarding his water-based antibacterial moisturizing mist. It's quite surprising because the WHO actually states that the only recommended sanitizer is alcohol-based, 70% and above. But when he showed me all these reports and the demonstration, actually we know that water-based hand sanitizer can actually work, and it is food grade. It's not irritating to your skin and your eyes. So move on to the next one, product sponsorship. Okay, this is also an interesting one. I approached this company called Saramonic, and I told them I need a microphone for my videos, and would you like to sponsor me the device so I can make a video about that? Then they said okay, and I got it. Yeah. What you are looking at easily costs more than 1,000 ringgit, and I managed to get it free. But in exchange, they would like to, they would like me to make a video and talk about it. Yeah. So besides online videos, what else can you do? Okay. So pay attention here. On social media, you are able to get reviews, right? Social media page reviews, and also on Google Maps. This is very, very important. Just like how you go to a new restaurant, you want to search for a new restaurant, you would go to Google Maps, you would go to Facebook, you would check their reviews. So please, if you see your patient is happy with you, once they have left the clinic, or even when they are outside the counter chatting with you, try to ask them to review your clinic, give you a good review. In exchange, you can give them some samples of toothbrush, toothpaste, that your supplier gives it to you. That's very, very good. Very, very cheap, basically free, next to free, and it has very good impact. I have so many patients that come to me that say, "Oh, doctor, sir, where do you find our clinic?" "Oh, doctor, I found it on Google." That's all, simple and cheap. Social media, you have to be active on Facebook, Insta, LinkedIn, and TikTok. Not necessarily TikTok. TikTok, the demographic is more towards the lower, younger end. So they might not have a lot of impact towards your practice. But Facebook and Insta, Facebook is usually 30 and above. Insta will be teenagers to 20s, late 20s. Yeah, LinkedIn is more for the professionals. And for social media ads is also a viable option. You can just boost your post on your page with very, very minimal amount. Just start from 15 ringgit. What else? Where else can you get such a cheap kind of advertisement? Nowhere else to be found. If you know, of course, go look up YouTube videos how to optimize your ads. And of course, look up NDC guidelines. Don't publish promotion prices, throw the prices and all. Yeah. But other than that, whether or not advertising is still a gray area, but I don't see anyone getting caught. So just to promote your services, let people know your clinic, your practice, I think it is acceptable. And another way is SEO, search engine optimization. Yeah, search engine optimization is ineffective nowadays. It was very effective. Yeah, it was very effective, but there are so many practices that knows about this tactic, and everybody wants to go inside, and it is getting more and more expensive for you to actually get that kind of optimization you want, because it has already become a red ocean of the sector, and it has become very expensive. Also, guerrilla marketing. The last one, what is guerrilla marketing? You can go actively on forums, Facebook pages, and groups. When you have any group members that post, it's not, please don't join too many dental, because dental groups, you will limit yourself to the dental community. You want to expand yourself beyond the community. So what you go to like big KL groups, JB group, Penang group, whatever, your parenting group, mommy's group, you join them. When there's a member that asks a question, you just go there, answer their question, give them some information, and tell them about your practice. Yeah. So at last, come back to the graph that you drew just now. Where do you fit? Where are you going to stand out? I'm not going to draw the line for you. Yeah, because it is your clinic. Only you know what is the best for you. So you need to draw a line between private sector and government sector. You have to draw one more line after this seminar. What is your clinic? Where do you fit? Yeah, and also you need to fill in this 4-action framework, because I cannot do it for you. It's your practice. Only you know the best for yourself. Fill it up. Yeah, and for the last advice, I want to quote a wise senior dentist from Bangsa. Impress your patients, not other dental colleagues. Impress your patients and not other dental colleagues. So let's get our brains working unconventionally, and thank you very much. Do follow me on Gigi Han on Facebook, YouTube, and Instagram. I'll catch you in the next one. Thank you very much.
All right. Thank you so much, Dr. Gigi Han. It was an awesome presentation. You took us through some very, critical yet important points. And for the record, I've just liked your page, so I'm following you now. Right.
Thank you.
So we went. Any questions that we're going to take, Dr. Fawaz, from the viewers? Dr. Fawaz, mic is muted.
Okay. We have the question from the first speaker, Dr. Ki Ying. Kenneth Kim wants to know how frequent should be the dental checkup for patients.
Dr. Ki Ying, your mic. Yes.
Hi.
Can you repeat? Sorry.
Yes.
How
Kenneth
often should we do dental checkup?
Wants to know how frequent should be a dental checkup for the patients in this COVID situation. Do we call them very frequently in this COVID pandemic, or it's okay to postpone it?
I think for now, our situation is quite stable, and we are all coping quite well with our precautions, our cross-infection control. So I think we can go back to just maintain at least yearly checkup, but the best is if you do 6 monthly checkup. I normally advise my patient, I would tell them see, this is the first time I see you. So according to the patient's condition, you have to advise how frequent should they come and get it checked. If they have really bad gum or teeth condition, you will have to check them more regularly, like maybe once a month until you think they're quite stable. You can space it a bit, like every 3 months and every 6 months in that sense. Yeah.
Okay, so I think basically it's wise to decrease the frequency unless, kind of once in a year for regular patients. Is that it, right? Okay.
Right.
Okay,
Yeah,
we have
the next question is from Dr. Tan himself regarding the mouthwashes. Which one should be used? Can chlorhexidine also be used as a rinse?
Chlorhexidine is not good enough in this COVID situation. So even in the guidelines, they will advise you should at least use iodine, and even you can use hydrogen peroxide. Yeah, chlorhexidine mainly maybe for like gum diseases you can still prescribe, but for this precaution before we start procedure to minimize the viral load, potential viral load in the oral cavity, we have to use either iodine or hydrogen peroxide. Yeah.
Right.
I think since Dr. Chong was talking about infection control, would you like to add anything to that?
Okay, with regards to the pre-procedural rinse to decrease the viral loads, yes, we do recommend the utilization of hydrogen peroxide or iodine. However, of course, if we look at it like to reduce the viral loads in the mouth, it will help. But in patients where you have the virus coming up from the lungs, viral particles coming from the lungs, how are you going to disinfect that? You see? So, of course, some people say yes, you do it. Some people say no. But of course, to be more safe, to actually reduce the load from the oropharynx itself, then yeah, you can use your pre-procedural rinses. Because you will not be working on patients who are actively infected or who are suspected of infections. So, whether you use a procedural rinse or not, that's another thing.
But definitely it's recommended to use a pre-procedural rinse.
Yes.
Right. So the other question was about established dental insurance in the market. Would you like to comment about that?
There are a few, I think, but personally, I'm actually using Dental Protection Limited, DPL, by the MPS. Costly, but very good coverage. So that's what I use. I've heard of Zurich. I think Chubb is coming out with some. You can actually search it online.
Right.
I think the question, the asker was asking about the dental insurance for the patient.
For the patients, you have to ask your insurance agents. Actually, I do have some patients asking me, do I know any insurance companies which covers dental treatment? I just tell them you have to refer to your insurance agents, because I don't know.
I have some note to add. So because we practice in Gleneagles Hospital, we are dealing a lot with insurance inquiry. So to my knowledge, our Malaysian-based policies, even if it's the biggest company like Prudential, Great Eastern, they actually they don't really cover dental. Even if you have abscess, cellulitis caused by infected tooth, you have to be hospitalized or even undergo GA incision drainage. But because this is dental origin, they actually will not cover. Yeah. So the lucky ones will be when there's MVA accidents, when you have trauma and you where there's jaw and teeth involvement and you need emergency management there and then in the emergency department, and you might be lucky enough to get insurance coverage. Yeah, so a lot of patients, when they need restorative work done after accidents or trauma case, they actually will try to pay and claim afterwards. So if they're lucky enough, they will get. But most of the time, we will get rejected. So this is something that I personally think the insurance policies in Malaysia could improve, because of these policies, people will actually think dental is not important. Like expat patients, they actually can get insurance covered for even braces treatment. So because dental is like so not highlighted in insurance policy, people will not think dental is important, and they will think like, I don't want to spend in dental. Like I don't want to spend money to maintain my good oral hygiene or to save the tooth. Instead of they're saving the tooth, they just never mind, just remove. Yeah. So this is my
I think,
experience.
yeah, thank you. Regarding dental insurance, I think this is closely linked with the patient's dental awareness. And then I want to ask Dr. Tan if this is the blue ocean for us.
Unfortunately, I don't think so, sir, because I have what I'm aware of. Tune, the AirAsia company subsidiary, they do have dental insurance, and most of my colleagues that have partnered with them actually dropped out after a while. They were not happy with Tune. Yeah, so I'm not sure about that, but it may not look good, sir. Thank you.
Right.
I think a lot of work needs to be done on this one.
Yeah, so I'm really impressed. I'm really happy that all of you could make it for this, webinar. Gathering PIDC alumni, and so many of you doing so well. So we would really want to wish you all the best, and hope to collaborate in future again. Right.
Thank
So I'm truly amazed. Thank you so much for being here and spending your precious time on Sunday morning, and now nearly afternoon. Yes, afternoon. Right. So hope to have more of these sessions again in future. Right. So we're signing off from now. Thank you so much.
Thank you.
Thank you, everyone. Bye bye.
Thank you. Bye-bye.
Thank you.